Spinal Curvature Disorders. Hey everyone! Welcome to today's session where we're diving into an important topic in human anatomy, spinal curvature disorders. So let's get started. What is a spine? The spine, also known as the backbone or vertebral column, is a series of bones, called vertebrae, that runs from the base of the skull to the tailbone. It provides structural support and protects the spinal cord. What are vertebrae of the spine? The spine consists of special bones called vertebra. Vertebrae are the 33 individual bones that interlock with each other to form the spinal column. The vertebrae are numbered and divided into regions. These are 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 sacral vertebrae, 4 coccygeal vertebrae. What are the 5 parts of the spine? The spine is divided into 5 main sections: cervical spine, thoracic spine, lumbar spine, sacral spine, and coccygeal spine. These sections are formed by individual vertebrae that interlock to create the spinal column. Cervical spine is formed by the top 7 vertebrae, numbered C1 to C7, supporting the head and allowing for head movement. Thoracic spine is the middle part of the spine, consisting of 12 vertebrae, T1 to T12, attaches to the ribs and contributes to posture. Lumbar spine is the lower back, made up of 5 vertebrae, L1 to L5, bears the weight of the upper body and allows a wide range of movement. Sacrum is a triangular bone, formed by the fusion of 5 vertebrae, S1 to S5, located at the base of the spine, and connecting it to the pelvis. Coccyx, the tailbone, formed by the fusion of 3 to 5 small coccygeal vertebrae, located at the very end of the spine. What is a normal spine curvature? A healthy spine, when viewed from the side, exhibits a gentle S shape due to 3 natural curves. The cervical spine of neck has a slight inward curve, known as a lordotic curve. The thoracic spine of upper back has an outward curve, known as a kyphotic curve. The lumbar spine of lower back has a slight inward curve, also a lordotic curve. What is a normal front view of the spine? When viewed from the front or back, the spine should appear as a straight line from the base of the neck to the tailbone, with no significant side-to-side curvature. Any significant deviations from this straightness, particularly side-to-side, are considered abnormal and may indicate a condition, like scoliosis. Now, let's get to the main topic, the disorders of spinal curvature. The 3 most common spine disorders are scoliosis, kyphosis, lordosis. These conditions involve abnormal curvatures of the spine. Scoliosis. The spine curves from side to side in an S shape or C shape, rather than being straight. It can affect any part of the spine but is most common in the thoracic and lumbar regions. Scoliosis is most clearly visualized in the antero-posterior or postero-anterior view of X-rays, especially when visualizing the thoracic and lumbar vertebral bodies. This view, also known as a full spine X-ray, allows for a clear view of the curvature of the spine, from the front to the back, enabling the measurement of the cobb angle, which is used to assess the severity of scoliosis. Kyphosis. Kyphosis is an abnormally excessive convex curvature of the spine in the thoracic region. It's characterized by an excessive curve in the thoracic spine. This is an abnormally rounded upper back, often described as a hunchback. Kyphosis is most clearly seen in the lateral, side view of the X-ray of the spine. This is because kyphosis is defined as an increase in the forward curvature of the spine along the sagittal plane, which is seen in the side view. This is the opposite of lordosis, which refers to an increased backward curvature of the spine. Lordosis. This is an exaggerated inward curve in the lower back, resulting in a swayback posture. It's primarily an issue with the lumbar spine, the lower back. Lordosis refers to an increase in posterior curvature of the spine in the lumbar region. It is most clearly seen in the lateral, side view of the spine X-ray. Lordosis is defined as an increase in the backward curvature of the spine along the sagittal plane, which is best seen from the side view. And that wraps up our session on spinal curvature disorders. Now you know the basics of the spine, its normal curves, and the 3 main disorders, scoliosis, kyphosis, and lordosis. If you found this helpful, Make sure to like, share, and subscribe for more educational content. Stay curious, stay healthy, and I'll catch you in the next one.